Hello. Good afternoon. I think we're going to make a start now. Welcome to the first session of the afternoon. I have the honor of introducing the next speaker, Dr. Noor Al Busaidi, who practices in Oman. Thank you very much for coming to visit us. She's the president of the Oman Diabetes Association, which she also founded, and the director of National Diabetes and Endocrine Center since 2012 in Oman. She trained initially in Oman and then completed her endocrine training in the George Washington Medical Center in the USA, and then moved back in 2003, where she has been a consultant in endocrinology ever since. She's a member of the National NCD Committee at the MOH and team leader for national obesity training initiatives in Oman. She's the founder and president of the Oman Diabetes Association, and she has also led the update process of national diabetes guidelines, both in the last decade and this. She was the first doctor in Oman to establish an obesity clinic, and her experience makes her ideal to come and talk to us about the evolution of obesity management guidelines beyond the borders of the UAE in the wider region, in the GCC and Lebanon. So, Dr. Noor, here is your microphone. Thank you very much.
Thank you, Dr. Matthew, for this introduction. Assalamu alaikum wa rahmatullahi wa barakatuh. I would like to thank the organizing committee for inviting me today, and I thank you all for coming and leaving your dessert. I'm sure you ate only lunch without dessert, right? Okay. So the topic I was assigned to is GCC and Lebanon guideline for obesity management. How many of you heard about this guideline? Can I see some hands? 1, 2, 3, okay, few, excellent. Okay, so today I'll tell you about the story of this guideline. The agenda of my topic, my title, I'll talk a bit about Obesity Federation Objective Overview. Then I'll focus on MENA region, void importance, and the establishment of this expert committee, the MENA region obesity challenge, the regional recommendation, which I'm supposed to go into detail, the current status overview, and road ahead. So World Obesity Federation, and we all enjoy the topic today of lecture of Joanna to talk to us about WOF. They are a global organization focused to address the growing epidemic of obesity. Their primary objective is really advocacy and policy influence, promotion of research and public education, professional training and support. They have a lot of resources like scope and global collaboration, partner with government, with health expert, with other society, whether cardiac society, diabetes society, or obesity society. So what about MENA region? Recognizing the critical importance of this region and its own absence, World Obesity Federation emphasized the need to take an action to bridge this significant gap. So WOF take care of the global, but there was absence of MENA region. And our region faces a lack of comprehensive public health policy, which lead to a significant challenge in addressing obesity effectively. There is limited data and research on obesity in our region, which hinder effort to develop targeted and impactful intervention. To go back. Also, in our MENA region, we have, as you can see, we have increasing prevalence of obesity with all the comorbidity of obesity. We see the comorbidity early on in our population. In MENA region, we have rapidly changing lifestyle, urbanization, processed food, lack of physical activity. And we are youth population. So seeing in our youth population the addiction on fast food and lack of physical activity really needs some solution. And our cultural factor, social norm, influence diet and lack of physical activity. So we need a prevention program tailored to MENA region. And of course, we have health system challenge, limited infrastructure, hinder effective obesity care in many MENA region. And also we have a lot of political challenges in MENA region. So for that, acknowledging the need for regional collaboration, WOF invited MENA obesity expert to initiate dialogue back in 2018-2019, resulting in multiple meetings, key outcome toward establishing a regional society. So what happened from 2019, there was official establishment of the steering committee for obesity expert named Gulf and Lebanon Network Steering Committee, establishment of patient engagement program, support for scope school training for healthcare provider, support the regional conferences, and co-development of regional recommendation for the treatment and management of obesity. Also support for public awareness campaign. So what is the regional challenges for obesity in our region? While the process of developing regional recommendation, there was 4 key challenges have been identified and highlighted for further discussion. Lack of comprehensive public health policy, number 1. Number 2 is the health system challenges in many of our MENA region, culture and social challenge, and individual challenges. MENA region faces critical barrier in addressing obesity, including policy gaps, weak implementation, limited insurance cover, and abundance of misinformation in the social media. Now, although there is, in many of MENA region, there is lack of cohesive regional and national policy focused on prevention, treatment, and education. And even if there is policy, there is weak implementation. Some of the country, they do have food labeling, they have taxes on healthy food, but it is poorly enforced and inconsistently applied. Insurance coverage, there is limited coverage of obesity treatment or access to multidisciplinary team, and treatment meaning medication or even surgery. And social media misinformation is a big, big thing in our region. There is a gap in regulation for online health content, lead to widespread misinformation and false claim about therapy, diet, and health practice. We see a lot in MENA region how non-professional in the medical system give advice and treatment for a patient. So a patient come to our clinic with changing medication, and when you ask them, they'll tell our neighbor told me, or social media told me. And so this is very, very common in our area. We have limited access to specialized obesity care and shortage of trained professionals in MENA region. So many MENA region lack specialized obesity service with shortage in trained professionals like dietitian, physiotherapist, psychologist, bariatric surgeon, and limited medication access. The healthcare professional also lacks specific training in terms of how to counsel patients with obesity or weight management or any detail of lifestyle intervention. There is inequity in health service. So there is disparity in existing obesity care between wealthy urban area or underserved area. I always feel bad for those patients who come to the National Diabetes and Endocrine Center from far away from Oman. They don't have access to most of the medication or the multidisciplinary team. So this disparity do exist now in many of the MENA region. Unregulated private practice is very, very common in MENA region. Unfortunately, a lot of countries in the MENA, private clinic, they use unqualified provider and the prescribe non-standard treatment. It's very common. One of the incidents, a dietitian prescribed Manjaro and escalating the dose weekly, and the patient end up admitted with vomiting and diarrhea. So this is happening every day. They sell medication on Instagram, totally unregulated. Obesity in the MENA region is driven by cultural norm, unhealthy lifestyle, and impact of aggressive food marketing. Of course, our traditional diet, basically calorie-dense food, lots of fried foods, sweets, refined carb, and to make that shift to balanced, healthy food is kind of challenging and sometimes unacceptable for the patient and their family. Social and family gathering. In MENA region, we are very social people, and food is the center of any gathering. So when we go out, we eat. When we're sitting, we eat. When we're happy, we eat. And when we are sad, we eat. Lots of focus on food, unfortunately. And if you invite anybody, they tend to force you to overeat. So part of respect, you have to overeat and try again and again and again. So that's, if you love them, you eat. Urbanization and sedentary lifestyle. Unfortunately, rapid urbanization has led to more sedentary behavior across the region, and that, of course, increased obesity prevalence. Marketing and media influence, this aggressive promotion of unhealthy food, and the concept of talabat, the food come to your door middle of the night or 24 hours, targeting children is really a main driver of poor dietary choices and unhealthy eating habit. So hardly at night people cook at home. They always order unhealthy food. Social stigma, discrimination, educational gap fuel the mental health and low self-esteem challenge for individuals in our MENA region. There is a lot of stigma in our region. Every day patients come to the clinic cheering. Stigma from health provider and stigma from the surrounding. And they tend to internalize that stigma. And that creates poor body image, feeling of guilt and shame. Discrimination also is a major. They experience discrimination at school, work, or even within family. They feel that there is something wrong with them, personal failure. Of course, that leads to depression, anxiety, and often lead to unhealthy coping behavior like restrictive dieting or binge eating. And sometimes also they refuse to go for follow-up because of this stigma. Educational gap. There is really major gap in health and nutrition education. So even somebody who's really educated, but when it comes to health, there is poor understanding what is a balanced, healthy food or what is healthy lifestyle. So now I'll come to the regional recommendation for treatment of obesity, Gulf and Lebanon. This is the publication of the recommendation, was in 2020. This picture was taken in Oman in December 2019 when the group met and they spent the whole day discussing about the recommendation. This is the list of publication authors from the Gulf and from Lebanon who contributed to the publication. And the content of the publication, it has concept of recognition of obesity as a disease, how to address and communicate, to talk to patient about obesity, what is the staging of obesity, and the core of it really is the clinical pathway for primary health care. So these recommendations provide guidance on approach for engaging individual living with obesity, including staging system and clinical pathway. So how to approach the 5S, what is the staging system, and what is the ideal clinical pathway being with engagement in primary health care. So in primary health care, of course, not all the MENA region has primary, secondary, or tertiary. But some of the countries, they do have the 3 levels. So in primary health care, they should handle somebody with obesity stage 0 to 1 and provide a simple lifestyle intervention or use some medication. So stage 0 to 1. And also it was recommended that patient advocacy office run by volunteer patients should be available in primary health care. So the basic group should be in primary health care, at least obesity educator, family physician, and maybe in secondary, they can have a dietitian or exercise therapist or psychologist. These recommendations outline the ideal clinical pathway for obesity treatment and management. But these recommendations may not fit all the regional healthcare system. So local workshops are advised to tailor each country to the context, and the discussion should be on addressing each healthcare coverage for obesity treatment, availability of fundamental and specialized obesity clinic, access to medication, way to improve obesity care delivery at primary health care, and the difference in the care between private and government, and they should have their own in-country guideline with the new recommendation. This is the recommended stakeholder who should work together in addressing obesity. So government, policy formation, the existing task force, media, non-governmental organization, healthcare provider, of course, patients should be part of it. So since 2019, when WOF came to the region, we had this recommendation, and there was in-country workshop to see what's happening in each country. Many things happen. So we'll go at each country. So in Bahrain, since 2019, they developed their own national obesity guideline. They have obesity briefing book. They train around 20 physicians. They do have obesity clinic at primary health care. In the prevention, they have project ongoing on prevention of obesity and diabetes, and also prevention of obesity at school. Also, Bahrain was elected as one of the 5 countries by the WHO to pilot an acceleration plan to reduce obesity. And Bahrain now is a member of World Obesity Federation. So good progress in Bahrain. In UAE, there is a lot happen in UAE. So they do have obesity management guideline and practice recommendation Abu Dhabi, but the national guideline is in progress and soon will be published. They do have scope training, and on Monday, one of it, they have obesity clinic with multidisciplinary team functioning in primary health care. There is a lot happening in terms of policy and prevention. They have comprehensive periodic screening program, taxation, front of back label policy, school canteen guideline, canteen for vending, guideline for vending machine. And they have program for active school and nutrition campaign. Also, they have a lot of regulation in terms of non-food marketing of unhealthy food for children. And they have registry for obesity. And that's really very impressive, because we're all looking to have national registry for obesity, not yet there, but they did it. Also, they have a lot of physical activity as a core for prevention. In school, they have the City Move app. They have the Conference International Society for Physical Activity. So lots of activity and movement in terms of prevention happening in UAE. Of course, there is a lot also a term of training and education and support with medication for the patient and community living in UAE. What about Saudi Arabia? They have their national obesity guideline for prevention and management, and actually they have multiple, and they update it from time to time. They do have obesity included in the Kingdom Vision 2030, and they have accredited obesity medicine fellowship program, and they do have scope training for health provider. Lots of obesity research ongoing, and they do celebrate World Obesity Day every year to raise awareness. Lebanon, they don't have a national obesity guideline, but they have consensus document for obesity management. Primary healthcare, they don't have obesity clinic, but doctors in primary healthcare, they do screen patients for obesity, part of the management. And they have obesity clinic with multidisciplinary in some private clinic. They do have scope training, and they do have some research going for obesity. They celebrate World Obesity Day to raise awareness since 2019. Qatar, a lot of things happening in Qatar. So they have their national clinical guideline. They established 6 wellness centers and 3 national tertiary care centers. And they have a lot of empowerment of primary health care center there. They have programs like Obesity Day and annual public awareness about healthy lifestyle. They publish more than 120 obesity-related studies in international journals, and they have fellowship program for obesity medicine and bariatric surgery, and certification in obesity management and bariatric care for primary health care. Actually, one of our fellows in Qatar having a fellowship training for obesity and bariatric. Kuwait, they do have obesity management guideline and practice recommendation. They train 300 health provider for scope. Kuwait, well done. They do have established obesity clinic in primary health care with support with dietitian or obesity nurses. At the prevention level, they have national strategy, prevention and management of chronic NCD. And also they have banned fizzy drinks and chocolate on school. And they have public authority for food and nutrition to reduce sugar and salt. They have many research ongoing, and they do celebrate World Obesity Day annually. What's happening in Oman? We do have our national obesity guideline. 2023-2024 was published. We do have obesity briefing book signed by our minister, where stated obesity is a disease, so we want that support. Obesity scope training, we train 45 physicians. For the multidisciplinary, on Monday, some dietitian and nurses will be joining the scope training here. Primary healthcare, they do have obesity clinic. We celebrate World Obesity Day since 2016. And again, a lot is happening in terms of policy. There is a national policy which is multi-sectorial for prevention of NCD. And of course, obesity is one of them, national nutrition strategy. And there is ongoing project, Ideal Weight Challenge, which is a collaborative intervention project between Ministry of Education, Oman School Sport Association, and National Diabetes and Endocrine Center to look at kids with overweight and obesity, give them lifestyle intervention and support, and follow them over years. There is a lot of research is going on, kind of strategic research with some funding. Also, Oman invested in training multidisciplinary team over the years. During COVID, we moved to online, and there is a lot of public initiative for education. And of course, Dana was with us at some point 2 years in a row. So in summary, the presence of WOOF and the creation of the Obesity Expert Network Group generated momentum and helped close critical gaps. There's ongoing training, guideline form and updated, continuous awareness effort, policy and procedure re-evaluated, patient support enhanced, obesity defined and introduced as a disease for public and policy maker. So what is the road ahead? Well, we are still warming up. We still need regional obesity registry. We need more of patient advocacy program. We do need regulation of social media platform. We need stronger public health policies. We do need access to care and medication. When I said access to care, to multidisciplinary, to train personnel in the obesity clinic. We need community education campaign. Definitely we need investment in research, and we need more of collaboration across sector. Okay, so to achieve success, collaboration and unify effort are essential. So we must work together, and we need all of you. There is an Arabic say, يد واحدة ما تصفق, meaning you cannot clap with one hand. And for that, everybody needs everybody. Everybody needs to act. We need WOF, and we need all of you to combat obesity. And I invite all of you to come next month to our international, the 20th International Symposium will be in Oman from 4 to 6. And there is 50% discount because of the National Day on Monday, 18. And with that, I would like to thank you.
Dr. Noor, thank you very much indeed for that wonderful talk.